We are meeting every Saturday over the last 2 years, bringing various topics. Today, we covered this topic last week, but somehow because of the new year, we could not. Uh, we had a request to cover this topic once again. So here we are. The topic we are covering is artificial intelligence in medical education and skill training. Please note that our ID from today has changed. If anybody wants to join who has an interest in this field, can come on this session, specifically for doctors and technology people. The meeting ID is 818-8591-1572. To talk about this interesting topic, we have Professor Dr. Arun Jamkar joining in from California. He is a distinguished professor in SIU Pune University. He's a consultant of healthcare. He is also working with Persistent Systems Limited. He's an ex-vice chancellor from Maharashtra University of Health Sciences, Nashik. I request the distinguished speaker to come on this board for talking about this beautiful topic. Over to you, sir.
Thank you, Saurabh. Can I share my screen?
Yes, sir, you can.
Can you see the screen?
Yes.
Thank you, Saurabh, for inviting me for this second time for the CMAAO meeting. Last time I talked about artificial intelligence in clinical skill training and medical education. Last time in the conversation, the people were more interested in medical imaging, so I thought I should give a little more attention. So let me thank CMAAO for inviting me for this weekly meeting. I've been introduced and thanked Saurabh. My work has been with system about intelligence. We have a lot of projects going on. And last time, I think I talked about this in National Conference on Health Professional Education. So let me briefly introduce what I've been talking from last time. Is about what is AI, what is ML. Actually, the term AI, which was coined by John McCarthy, is defined as a machine with intelligent behavior, such as perception, reasoning, learning, communication, and ability to perform human tasks. So these are the 5 things: perception, reasoning, learning, and communication. In fact, now in medical education, we need communication skills, and there are some experiments being done on communication skills. There has been a lot of sentiments against AI that people are reasonably worried. Even Stephen Hawking has said that the development of full artificial intelligence could spell the end of human race. And then Elon Musk in Bloomberg, Ashley Vance, where he was writing, when we were talking about the biography, he was talking about the same thing, that it's not only the question of what it can do, it's a question of maybe some accidental possibility of doing some nonsense because of a fleet of artificial intelligence enhanced robots. They might be capable of destroying mankind, but I think that is too large a thing. Anyway, all possibilities are done. More than 100 robotics and AI pioneers, including Tesla CEO, they are asking for UN to develop a UN-led ban on illegal autonomous weapons. AI came into picture about after first time the Watson address and the being Jipani. But not only that, the IBM, the Deep Blue, it beat Gary Kasparov. And this was the IBM supercomputer Deep Blue. And then the reigning chess master was defeated. Then afterwards he thought that he has not been given enough data like the Deep Blue. And then subsequently there are a lot many things happening. And then IBM debated, which were also the has won. And I think there are a lot more things going on. I'm fascinated by technology. And if you go to my website, arunjamkar.com, where I proudly say that technology can only solve all problems of healthcare. For those who are interested in going into details of my talk, because I might be talking brief, but then showing those slides, you can access all those slides from my website. It's all about called as artificial intelligence, and then there is more development taking place. Afterwards, after the NVIDIA has come into picture, and when I visited NVIDIA, where my son works, there's a nice mural called "I am an AI," and even the T-shirts are available, which say "I am an AI." And the rapid growth of AI is because of its possibility of using, say, graphic processors in what you call as image handling. And then there is some law called as Moore's law, where the CPU growth is given, and then it has been seen that the GPU growth, what's called the graphic processor, is faster than CPU. In fact, at present, there is so much of growth that all this audiovisual, it could be a 60 billion opportunity. And recently, NVIDIA unveiled a monster called A1100 AI chip. So, in addition to the AI, we need to talk about other two things called IoT, that is Internet of Things, where there is a connectivity of all those equipments to the internet. And then we have what is called as IoT for healthcare, where we have headsets, clothes, sensing devices, monitors, glucose monitors, ECG monitors, pulse ox, and everything. And that's why now we call it Internet of Healthy Things. And then other thing which comes is what is called the wearables. And the wearables which are connecting say biological parameters and giving the data of the patient to the system. And it's a change whole thing. People think like a Apple Watch is a wearable, it's an ECG monitor, and then not only that, it can give you a clue that you are falling down. And in case you don't respond, and it can directly communicate to your near dear that your dear has fallen down. So let me introduce the three terms. I'm going to go into a little brief because last time I covered all of these. We have AI, ML, and DL, and the AI is computer mimicking human behavior, sense, reason, act, and adapt. Whereas ML is algorithm that gradually improves. So something that is more important is ML, which improves with the what is called experience. And then the deep learning, what's called DL, is learns from the vast amount of data. And the examples are AlphaGo, self-learning cars. And what is more important now is suddenly because of the EMRs and EHRs and everything, there is big data available. First time this extremely big data available. This data is coming from various sources, and overall this data could be useless. But then at the same time, there is so much of knowledge in that it would be criminal not to use them, and that's why we require AI for identifying this data. And then we have a limitation for human use. that the medical errors are occurring, and the amount of information available is doubling every 5 years. And I think that whole thing comes to the experience, and we require AI to identify what are the development taking place and to find out how we can use. And then you can find out all the physician can diagnose based on say personal medical histories. So there is a vast difference between how a human mind can diagnose and how AI can diagnose. AI can diagnose diseases based on complex algorithm using hundreds of biomarkers, aging individuals of millions of patients, and aggregated clinical data. So I think you can't just compete, and that's why uh, AI might be helping. At the same time, AI could assist a physician in many ways, but unlikely to replace. The healthcare system has to travel from what is called as reactive health to proactive health. So reactive health, individuals look for medical help they are unwell, whereas in proactive health, so with variables and IoTs, the data is captured continuously with the medical grade variables, and then you are going to find out when the patient is going to be sick, and then giving say some help before the disease occurs. I think this proactive health is only possible with AI. There are data types available. And then I think if you see the work of AI, the maximum work is being done in diagnostic imaging. AI is getting useful, applying for critical care, say artificial intelligence uses machine learning, and then you store data. At the same time, there is a lot of concern about getting it sympathetic, to getting it to the mind. That's why now we want to call it what's called as artificial wisdom. So artificial wisdom can be described as an artificial intelligence to the top level of decision making when confronted with most complex systems. That's why, because machines lack human qualities like empathy, compassion, I think this whole thing can come once the artificial wisdom comes. And therefore, if you see the growth, so it travels from what is called as DIKW model, the data, information, knowledge, and wisdom. And I think for up to the knowledge, it could be done with AI. But then wisdom, you require something more than say AI. So medical education, clinical skills, everything requires augmented intelligence leading to artificial wisdom. So let me just go ahead and explain you what is machine learning. In machine learning, the system has the ability to learn and it improves their performance. That's why I've just seen one video where the ML is being used for creating robo. And then it was just asked to walk. And then it was given input from inside. As a net result, after say 10,000 feet, the robo itself learned and it started walking like a man. I think this is how it can help. So machine learning are variously two types. One is called as unsupervised machine learning and supervised machine learning. And there's a basic difference. Now the unsupervised machine learning is what's called as given in examples and then code. Whereas supervised learning, where we give some data and then ask them to say copy. Let us say give example of now that there are a lot of things being done with machine learning and deep learning in COVID pandemic. So even the development, a fast development of a say MRI based vaccine was because of machine learning. And not only that, there were several drugs and everything being done that was all with machine learning. Now, let us give an example on difference between supervised and unsupervised. In a supervised learning, suppose you have a COVID, and then we give say what I call as images of lung, which are positive in the patients of COVID, and then the training would be done to find out where these images are present, and it will find out how it could be COVID or not. In an unsupervised machine learning, all patients, all X-rays of positive patients would be given, and then what you call as all those images would be classified, and then they go into what is called as a clustering to find out which image, which opacity is positive as correlation with say COVID. So as a net result, in supervised learning, we know which shadows are there, which are positive for COVID, whereas in unsupervised, the machine itself will find out which shadows are positive for learning. So I think there are various types of what is called as in supervised learning. We are commonest is neural network, support vector machine, and then random forest. Whereas in unsupervised, you have k-means clustering, hierarchical clustering. And in deep learning, it's an application of machine learning that uses complex algorithms to go into deep neural network. And the word machine learning was first time used by 1959 by Arthur Samuel, where the deep learning was used first time by Rina Dester. I think this is an history of how the development of things are taking place. And then CNN is a direct copy of biological neural network. And then what is happening is once you put a given input, then there is image processing. And then there are what you call as hidden layers. And at the end, we want to find out what is happening. So we are the things that whether it is a tumor, whether it is normal, a stroke, or hemorrhage, from input to output. And then therefore we have all these deeper layers. So deep learning is a sort of copy of a subset of a supervised learning. So let us give an example. Suppose you have a labeled data, the image of Tom and Jerry, and then once you do data cleaning algorithms, at the end, any image given, that has to be classified which is Tom and which is Jerry. So the step is first you have to do data preparation, where then all the images are integrated, and then we have what is called as the feature engineering cycle to find out which feature are positive in which site. So obviously in a, what is called as a supervised machine learning. Then it generates the features and then do models, it creates algorithms, and extract, and then afterwards, when that whole thing is there, then we deploy a new image and it can give classification. So there are several what is called as software available. The commonest one is called the TensorFlow. It is available free from website. Then we have Google Cloud Platform and Keras. Now, I just remember I was talking to MIT ADT University about medical imaging, and then there was one question from one individual.
Sorry to interrupt you. Your voice is muffling over here. We are having a hard time hearing you out.
Okay.
If you can just check your internet speed or probably the mic.
I'm talking on laptop.
Yeah, but your voice keeps on moving. It keeps muffling in between.
Vibrating.
The speaker is not very clear. The mic is not very clear.
So shall I shift to other room?
Would you? Yeah. Would you? Otherwise, would you like to read?
Okay. Just wait.
And you can also close your camera, I would say. It may help for the internet.
Welcome. But is it okay now?
Yeah, it's much better. And I suggest I will close your camera and we will open it once the slides are over.
Okay.
Okay, go ahead.
About this. So joining us now is our expert Tommaso. Tommaso, great to have you. Thank you. Nice to meet you, Chris.
So maybe you can tell us in what areas artificial intelligence is about this. So joining us now is our expert, Tommaso. Tommaso, great to have you.
Thank you. Nice to meet you, Chris.
So maybe you can tell us in what areas artificial intelligence is already integrated into the daily workflow.
As you may know, as part of the clinical workflow of radiotherapy, one needs to contour the organs at risk because basically you want to avoid them during the intervention. You want to preserve them. You don't want to kill these organs. And this is a tedious process. It takes time. It's costly. The clinician has to contour all the organs. And this is exactly a perfect example where AI can make an impact by providing automation and therefore help streamline the contouring process and increase the throughput of radiotherapy sites.
Okay.
And this is just an example of out of the 30 plus products that we are here that are already AI powered. You can check them out on the booth.
You know what? That's an invitation. So why don't we do that? Let's go check them out. Now let's have a closer look at how AI is expanding precision medicine with the help of this brand new device here presented at the RSNA 2017. And with that, I'd like to welcome our expert, Mark. Mark, great to have you.
How you doing?
I've got to tell you, I've never been on a scanner like this before. So what's so special about this?
Yeah, so what we're introducing this year at RSNA is the fast integrated workflow with the new fast 3D camera just above you there.
Okay.
Basically, this is powered by artificial intelligence. We've got a lot of algorithms in there working as soon as I press one button to position you properly. So in the past, we used to have to do all of this manually, but now what it's done is determined where you are lying on the table, whether you're head first or feet first. It's already checked the position from shoulder to hip and the perfect isocentering as well. So now you're ready to be scanned.
Oh, I got to tell you, Mark, this is kind of comfortable.
Certainly is, but we don't want you on there for too long.
Now, I know what you're thinking, but no, this is not a game chair. I'm trying to find out how AI is actually changing the way radiologists work. So for this, I'd like to welcome our expert, Valentin.
Hi, Chris. How are you doing?
Nice to have you. So maybe you could tell me how this actually works. What is this about?
In our advanced visualization software, Singovia, already today we make use of a broad portfolio of AI-powered algorithms to help radiologists in their reading.
So maybe you can give us a specific example of how to assist radiologists?
Absolutely. So one tool we have newly introduced now with Singovia BB30 is that the software is supporting the radiologists by automatically segmenting for them the lung, the heart, and the aorta. And all that is powered by AI algorithms.
That is amazing.
This is really great.
You mind if I stick around a little bit and try?
Not at all. Go for it.
So I'm just going to introduce, so what are the various imaging, AI system being used in imaging. So the first one, which is low-hanging fruit, is skin diseases, where dermatologists, they have a lot of, these images, and with a deep CNN, they are able to diagnose all those diseases with two views. And not only that, there's an AI app available called as the first derm. There might be several things like this, where you have to just send the two views of your skin disease, and it gives a diagnosis. Now, the other thing which has been approved by FDA is diabetic retinopathy, and is actually the AI was approved first by FDA for histopathology, but it was not used at that time. But a retinopathy is being used, and then it is used for screening of retina for diabetic retinopathy. And then we have what's called iNux AI-based DR system, and then it's very easy. And then because the patterns are less, and therefore it is very easy to screen, and maybe it's easy to anticipate. And then we can talk about radiology. And then radiology, there's several things available: X-ray chest, the CT scan, MRIs, PET scan, CT angio, MR angio, everything is available. And then if you see, the Siemens is doing a lot of work, what is called as Siemens Healthineers, and these are the various areas where the AI system is being used. Now let us start giving some examples. of say large-scale automated reasoning, and it's called as a dual convolutional network. And then if you give the X-rays, now this I think one of the biggest network where more than 47 lakh X-rays were there, and then it was for X-ray chest, so frontal and lateral view is given, and then it goes into a DNN system, and then it is able to give all those diagnoses which is given. And then if you can see the success rate of say individual compared to the dual net is almost comparable. Then these things can be seen with another network called ChestNet, where we can find out the deep learning of stress radiograph. You can see the comparable results with individual. And not only that, if you can see all these atelectasis, cardiomegaly, consolidation, all those findings of X-ray chest, the diagnosis of radiologist and an algorithm is almost same. There might be somewhere like emphysema or hernia, where radiologist is better. And then we can do several examples, MRA, where all those things are available with another network. And so much so that there was a recent paper about AI system being used as one of the student for appearance of a Royal College of Radiologists. And where it was giving a comparable result with, I think, 45, say, students. And even success rate was as good as those. Other AI has been coming to a lot of picture is mammography. In mammography, I think there are a lot many these shadows in microcalcifications, and there's so much of variation that the input, you see all those images, it goes into CNN, and you have to find out the output is only three things: malignant, benign, or normal. And these papers show that the radiology resident, you can see the graph, the radiologist, you can see the graph, and then if you can see the neural network, it is 0.89%. So much so that there was international validation. This is the paper published in 2020 about 25,000 women in US and 3,000 women in UK, where the panel of radiologists, of 8 radiologists, and the system was found to be better than radiologists. Then we can have an endoscopy. Now, I hope you all know about gastroendoscopy, and then we have direct endoscopy, or what is called as a virtual endoscopy, where we do, say, 3D images from CT scan and MRIs. And then these are various types, what's called upper GI, lower GI. Upper GI is upper gastrointestinal tract, where the endoscope is passed to the upper 8, and the lower GI is passed to the anus. And then we can, when the area between is not covered, then we have what is called as a capsule endoscope. And deep learning analysis, now that we can have Helicobacter pylori coming from image handling, where the sensitivity is 75%. And then not only that, you can identify one of the network called gastric net, where it was identifying automatically the cancer identification. And these can give you all those clues about which cells are present, and then which can give you diagnosis of gastric cancer. You might have heard about a movie called Fantastic Voyage, where whole, say, everybody was miniaturized and passed through vessel, and it was like a submarine going inside. Now, this whole thing is available with what is called something called as a capsule endoscopy, where there's a capsule with a camera, with a battery, with an say power to transmit those images, and then you have to just swallow, and then that whole images come out, and they come because upper GI and lower GI only accessible. The middle intestine, which is long, there might be some bleeding, polyps, and then you get all those images, and then the AI has been used to find out what are those images and finding out video analytics. And you can find out it is coming almost very close. And these deep network are able to identify even polyps. And say this is one of the paper where you can see those appearances: bubble, turbid, clear image, polyp, and then the appearance you can see is almost 98%, 99%. It's coming to the close. And virtual endoscopy also we do same thing. And I think computer-read colorectal polyps, we can do that here. Now I can just show you how polyps are diagnosed with AI.
Artifacts and the analysis of the motion of the endoscope. One main contribution is the automatic localization of polyps in clinical colonoscopy. Colonoscopy consists of two different phases, insertion and withdrawal. During the insertion phase, the colonoscopist drives the endoscope to the second. During the withdrawal phase, the actual intervention is performed.
An image can be viewed as a 3D representation in which shadows correspond to valleys. In colonoscopy images, these valleys correspond to shadows created by the polyps. We first clean the image to remove undesirable shadows. Finally, we integrate value information in an intelligent way to highlight those areas of the image more likely to contain a polyp.
The final outcome is a heat map in which the hottest point corresponds to the presence of the polyp. We verified that this map corresponds to the actual regions that attract the attention of the physicians. We validated this by means of eye tracking experiments. Artifacts.
So this is trying to show you how an automatic gastrointestinal polyp detection can be done with AI, and I think it is giving you a lot more success rate. And you can find out a system where the success accuracy is almost 98%. I think this is one of the biggest triumph for detection of as a colonic polyps. It is being used now in histopathology, and I'm not going to talk much, but I think what is important in histopathology is we are trying to develop the machine learning techniques, and instead the detection will drill the cell-wise to find out what is happening, and then it has been seen that in metastatic breast tumor lymph nodes, the digital histopathology is far better. And then we have slide scanners, and what is coming now next is we are doing what is called as whole cell images and tissues, and developing into what is called as the 3D images. And so now I hope everybody knows that in histopathology we have blocks, and we cut down one slide, which is in micron thick. Whereas suppose you do a 3D image, I think a whole thing can go down, and then it can even just transfer whole of the areas. And the AI approaches are giving you a lot more importance, and then FDA has already approved, and I think the chances of having a 3D image of whole block, I think is going to change the time. In operation center, you want the rapid diagnosis for some what do you call that? All those things are being done. Operation center. So you can see now that let us say we want to take a bath, and the chip is on operation table. We also from the tissue, and then that whole thing is cut. And we already 3D image, and the operation center itself, whole thing can be loaded. And then we'll scan, get an image, get a series of image, and then we do diagnosis. Fastest available. so that the tissue type is available surgeon in operation theatre. So I think this has changed. This will be changing the whole thing of management and it becomes so rapid that otherwise the patient has to redo or reoperate. I think this is a what do you call it as a life changing. Same thing is happening in coronography. Say coronary angios, we are interested to find out whether there is a plaque or there is a stenosis. And then these images can go down and we can find out a coronary CT angiography is able to find out the stenosis compared to the plaques. And these are other examples of deep learning analysis to find out where we have, say, stenosis. And this is another paper where sensitivity of all these techniques in coronary is 84%. It is being used in even nuclear medicine. Now, nuclear medicine itself is a big topic. There might be several types of images, but I think it has been used in SPECT scan, all those scans. Now, last time I talked about AI system being used in medical education. I'm not going to talk much because it can be used in curriculum where we have AI techniques being used for 3 levels of medical education. Then with the CBME coming, the AI system could be used for what is called as an academic governance, where all those, what is called as competencies are being taught, and with, say, horizontal integration, vertical integration. And then I think this is so much of a complicated thing that AI system can help to academic governance. Then it can be used for assessment, where we could have say database of question papers and calculated with the difficulty index and differentiation index, and we can design new question papers, say on whatever set you want, and then you can create a rubric, and this assessment could be done with all those possibilities available. Now, other thing is it can be used to find out an assessment, because while do assessment, there are 2 things happening. One is called reliability and validity. And reliability and validity both are absolute. However, method depends. Now, what is required is if you want to have reliability. Now, these are the various methods of the evaluation: MCQs, essays, PMPs, oral exam, long case, OSCE, mini CX, and there is a variation of reliability. But then, if the testing time is 1 hour, the reliability differs. Whereas the testing time is 8 hours, all systems are reliable, almost same reliability. So what is important is, if you want to increase the reliability of a tool, you increase the time. And that's why what we are suggesting is we should have what is called as a dynamic real-time assessment of student. That student volunteers to get dynamically evaluated, he chooses the topic, then the system will find out his resources, lectures attended, books, clinical cases, everything done, and then it will monitor. And then find out at a given time, when the student wants to get assessed, the question paper could be created by the system to the data bank, and then it could be directly assessed. I think these are the question papers which you can come through a dynamic things. And I think that is one of the things which we are going to change the picture. Now, it can help for resource management of student, that all those global resources, say all things can be identified, find out what the student is reading. And then it could be connected with the EHR system to find out, suppose to guide the student. And let us say somebody is reading about endocrine. So which patient is there, which theater is operating. I think this whole thing can help with the AI system to have a better training of students. Now, the skill training is one thing which is now the test of time, where now we are various types of skill training available. We are not discussing about teaching or cognitive domain. We are discussing about say how the AI systems can be used in skill training. simulation, chatbots, communication skills, and ops, and then virtual reality, robotics. Now, the simulation technology.
Take a look at this.
Cactus 15.9, required to contact on maintain 15,000.
Maintain 15,000, Cactus 1549.
Cactus 15.9,
Simulation is being used
This is
for
Cactus 1539. Hit birds, so your response to us.
this flight, when it was exposed to the birds,
Okay, you need to return a little while.
it was advised to go back. His knowledge about simulation
Stop
said
your
that you should
departure,
land
emergency returning.
closest to what reporting.
1529, he bird strike, he lost all engine, he lost the thrust in the engines, he's returning immediately.
Cactus 1529, which engines?
He lost thrust in both engines, he said.
Got it.
Cactus 1529, we can get it for you. Do you want to try to land 1313?
And I think this was the simulation technology that helped to save these passengers. Now we have various types of simulators available. I'm going to talk about laparoscopy simulators, where we have D1C, DV trainer, ROS, and now these all trainers, they teach you in what's called the real-time actual dynamic operations, and therefore you cut it bleeds like normal thing, yeah, and it can use like all operative technology. I think this is one of the things which can nicely train you. There are all these simulators, and then there are various simulators. There were some from ROS, although it's very costly, but then it gives you all those options of end-to-wrist manipulation, camera clutching, fourth arm integration. I think this is one of the best one. And then in persistent, what we're trying to do is developing an AI-guided surgical orientation system. It will be used for laparoscopy. Because of all my NDAs, I can't talk much. But I think something will be like this, that the moment you put the laparoscope inside, it can identify the organ depending upon all the images outside. And then that whole thing is based on AI data of surrounding organs. Now the tip itself will have ultrasonic, and then it can guide you. And that's why I suppose I want to do cholecystectomy, and I have taken a trocar in umbilicus. And then the system can directly guide you how to go about giving you details of the organs around and how to go inside and then go direct to the gallbladder. It will be something like a Google map guiding you. Now, I talk about GI endoscopy, where all these simulators are available, where everything in the colonoscopy, endoscopy, gastroscopy, everything can be done and trained, and the skill training can be available through, say, AI systems. Not only that, we have orthoscopy, which is called Vitra mode orthos, where the knee, shoulder, hip, all orthoscopes, they can be trained with an AI. Then laparoscopy, we have already seen. Then urology, you could do TURP, say with the stones. Everything can be done through a training module. Then we have obstetric gynec, where you can do hysteroscopy and even say laparoscopic hysterectomy. So simulation technology has been used, and then actually as per ACGMI guidelines, we require patient care, medical knowledge, practice-based learning, interpersonal communication skill, professionalism. I think this whole thing can come, and during a ward rotation, where the resident can show, and then all those aspects can come, and then it can give a competency assessment with the simulation of all those skills. And the virtual reality can come in the same thing. And then now we have seen the GI endoscopy, and endoscopy has been taught through real patients. But I think with all these endoscopists and all these systems, it can train you. And it has been found out that the range would come, that the scoring range from 7 to 35. So once you are trained with all virtual reality, it is giving you better training. Virtual reality is almost coming in picture, where with a Google goggle, or maybe you can find out what exactly is going on, and then we can have a system being, say, found out where a support vector algorithm was used for, say, hemilaminectomy done by different surgeons of varying skills. So AI-based VR training has been used in neurosurgery using 4 metrics of safety and safety of movement. And this provides a metric-wise assessment based on weight of each metric, and this can be applied to evaluate skill levels. Then machine learning to assess surgical expertise, what is called MLAs, machine learning assessment surgical expertise checklist was there. We have a checklist which can find out the quality of discussion, design of study, structure of data, and then supervised machine learning can find out giving into the details to find out how the VR system is happening. And there are several papers available regarding all these networks are available to find out how we are evaluating. Then we can train through the robots and then surgical skill assessment through robots with advanced robotic surgery. It's possible to get data from robot in many forms. It can be video data or kinematic data. Processing this vast amount of data is expensive and time-taking, but the use of machine learning is doable. The initial study used kinematic data for skill assessment. I think I'm not going to go in much detail, but all this surgical skill assessment through robotics could be done with AI. Now, in robotics, one of the main disadvantage is whether you have haptic feedback. Now, we all know haptic feedback because all our mobiles and we have even desktops and computers where they are sensitive to touch, and therefore touch feedback can be given through robotics, and kinesthetic and cutaneous feedback can be given. And then modality of touch is very important, and robotics can teach you to possible to gauge a tactile force being used by surgeons. One of the example of assessment is what is called as DOPS, direct observation of procedure of skills. Now in DOPS, we just want to find out video analytics can be used to find out how the operation is being done. Now the video analytics being used by sports skill training, say tennis, soccer, cricket, all the players, they study the movements and they study the counteraction. And we can do similar thing where we are finding out what's called as hand motion entropy and timing metrics to discriminate levels of surgical skill. And this finding can joined with individual procedure scores, and this measure can be collected by using consumer level cameras and analyzed automatically. And I think these whole things, say we can do locally to find out a video analytics, and it's available, not very costly. And then DOPS could be analyzed video. And then I can give an example of a DOPS being used for, say, laparoscopic appendicectomy, where you can compare DOPS between anatomist, expert, residents, and I think the whole thing can be analyzed to find out how exactly we are going, and the direct observation of your procedure can be done and we can be compared. And then there was a paper to find out where synchronized video and motion analysis for assessment of procedure in operation theater, where it could be done far better with a DOPS-like technology. Can we use it for diagnostic skills? Now, we have been using what is called as eye doctor, called AI-based drug dispensing ATM based on symptom-based algorithm. Now, algorithm-based mechanisms are available, and these are FDA approved. And if you can see, there's so much of explosion in these algorithms that we are trying to do one where it was a symptom-based algorithm going into say analysis and finding out which drug is used, and we're using for primary drugs. So we had a kiosk. We have to sit down, and then after individualization, the questions will ask in order to see that the system is entirely dependent upon getting your symptoms, and there is no no touch from the doctor, the system will find out whether it is safe to give you drugs without examination. And the system will take your blood pressure, ECG, pulse ox, and everything. And once it thinks that it can be given, then it directly can deal with, say, 50 drugs. Now, these were the algorithm to find out, say, what are the things, and which is all, it may be rule-based, but then it was put all afterwards to machine learning to find out and to improve itself. And these are the whole systems. Let us say it's an abdominal pain. It asks you these questions and then gives you a drug. So this whole thing could be used for evaluating diagnostic skills, because all these flow charts are available for differential diagnosis, and it can be used for history taking, it can be for assessment of students, and for evaluating clinical diagnostics. At the end, I'm going to talk about AI system being used for communication skills. Now, where there's this nice paper available called, they created one program called Empathic, and where the program will teach you how to talk about reflective reasoning, empathy, enhancing, say, all those things could be taught. And then instead of some teacher teaching you, and usually we teach communication skills by asking the students to observe a role model, and then we try to improve. I think same thing can be done with a machine, where you are dealing and talking with a machine, with images and with videos, and therefore we can find out, and then question being asked by the machine, and then we have to answer. And I think this whole thing can train you in communication skills. So much so that this paper shows that a comparison of communication skills on advanced communication OSCE, where a student trained with the software, with the AI system, was doing far better than even actual teacher being taught. So this is in brief how we are trying to teach skills through AI system. So technologies such as deep learning, machine learning, AI promise a benign solution for these thorny, complex problems. But this view is misguided. While AI has revolutionized aspect of technical medicine, it has brought in its way practical, conceptual, and pedagogical and ethical conundrums. For example, widespread adoption of technologies threaten to shift emphasis from hands-on embodied clinical work to disembodied technology-enhanced fuzzy scenarios, muddying ethical responsibilities. Where AI can offer powerful sharpening of diagnostic accuracy and treatment, all technologies and warm handshakes on medicine need to walk hand to hand together. So, in conclusion, as regards this training is concerned, AI, deep learning, ML promises skill training. Simulation technology, VR, robotics can smoothen the process of skill education. Communication skills and skill evaluation can be effective with AI. AI can add edge in clinical diagnostic skills and other cognitive domains. Machine lacks human qualities such as empathy, compassion, and therefore patient must pursue. The consultations are being led by human doctors. Furthermore, the patients cannot be expected to immediately trust AI, technology shrouded in mistrust. So thank you.
So thank you so much, Dr. Jamkar, for excellent and a detailed presentation. Yes, we understand there were some audio issues in the between, but I will send you the slides, whoever needs it, in the group after this thing. Dr. Jamkar, can we close the presentation? Yeah. Okay. So I would probably want to open his video. Yeah. Okay. Dr. Jamkar, you can open your video. And I welcome Dr. Chong, our chair. And we would take this question answers now.
Yeah.
Directly. Yeah. Dr. Chong, over to you.
Thank you, Dr. Jamkar, for that wonderful presentation. It's quite illuminating to see that there's so many applications in using AI in medicine. It's quite amazing, actually. I didn't realize that the scope and the breadth of this AI has penetrated into so many fields in medicine. I'm just curious about I'm also I've dabbled a bit of this AI thing. What are your own thoughts about personalized medicine with the N of 1 algorithms?
So I think, as I said, we are talking about reactive health. We expect patients to come to you and complain, and then we diagnose and we evaluate and treat. So with AI and all that, with variables and IoTs, the patient can wear all of them, and then any small change that is happening, which could not be even traced by the individual, the AI system can diagnose, and then patient will come before he has symptoms, and maybe with early symptoms. So I think this is going to change his personalized medicine, because the whole thing will be now, we are just having variables, but then we could have some programs with the genetics, programs with probabilities, and I think that whole thing will change whole of the medicine together. I think it is going to be a world different.
Yeah, thank you. Any questions from the floor for Dr. Jamkar?
Yes.
Please go ahead.
Hello, I am Professor Bukhari from Pakistan. Really, it was a very nice lecture, very presentation. I hope so many presentation will be needed to understand this thing. Dr. Arun, what are the different tools to use this artificial intelligence in telemedicine?
I think that the whole concept of telemedicine itself is AI-based. Now, the model which I talked about,
I understand.
iDoctor, that symptom-based algorithm, it could be telemedicine. Now,
how to assess the patient?
No, what is happening is the ones, everything that can be transmitted across from patient to the machine, the connecting wire can take it to telemedicine. So I think the AI is going to have, say, drastic change for, say, telemedicine. Unfortunately, in India, before COVID, there was a lot of restrictions on telemedicine. But now after COVID, all those restrictions has gone away. That now people are interested. Now let us say you want to monitor a, say, cardiac monitor, and you want to find out, say, while the patient is in ICU. Now, the moment we have connections available, a doctor sitting at home, looking in his mobile, can identify what is going in to the patient. And so much so that a nurse can be there in the ICU, and then the multiple patients could be diagnosed and monitored distantly by a cardiologist. So in, say, Asian subcontinent, where we are short of cardiologists, we are short of experts, I think this whole thing can be done. Now, let us say radiology. The moment you are uploading, now the maximum trust is in radiology. Now, we have a company called Krishna. They do 5,000 X-rays per day, and all X-rays are uploaded. And then somebody sitting in the office diagnoses, and then gives back the, say, management. Now, what is most important is, let us say, X-ray chest. 90% of X-ray tests are normal. And I think a AI-based radiological tool can definitely tell you that it is normal. The question comes when it's abnormal. And I think a radiologist, we can examine, say, 100 X-rays per day. With AI-based technology, can examine at least 200. So I think it's not going to replace radiologists, but I think substantiate is all work.
Okay, connected to this question, you do not think that telemedicine, artificial intelligence will make the people more lazy? And how can we reduce the cost of this one, because it is most costly things to use in our setup?
It's not very costly. Let us say we want to do now, as I said, all government machineries in India, they are using telemedicine for teleradiology. Now, Apollo is following teleradiology. So this is a boon for developing countries, so where you could have a machine available. Now, the advantage of AI is even a small image can be used. So we have some say miniature X-rays available, which can be diagnosed. I think that can substantiate the use of miniature radiology.
I see Dr. Monica had some post about AI. Would you like to comment, Dr. Monica?
Thanks. First of all, Dr. Jamkar, what a fantastic presentation. You had so much information, so many examples, and such a breadth of information that you provided for us. Just some comments. I was typing in the chat box, so I gave everybody else a chance to speak, but I was just wanting to kind of talk about AI because how it has really jumped out to the forefront of everyday life with ChatGPT. So that is like the first thing that I think the world is seeing about we are in the new age of AI. And everything that you're talking about now is all coming to the forefront. Now, specifically in the world of diagnostics and medicine, this is going to be rapidly changing. We have a very large electronic health record system. There are algorithms that are being used in the background in terms of health quality measurables. But I think with all the advances that we have right now, I think there's some work to be done for the application and for AI-based processes to be used ubiquitously and across all specialties. All I was saying, the question in the chat that was posted was, what are the risks associated with the usage of AI in healthcare? And I want to go back to how we do critical appraisal of published data. Whenever we look at a clinical trial or a clinical study, we look at table 1. What are the demographics of the patients that are included? Do the patient demographic apply to the patient population that we take care of in our patients? Do we have the right age group? Do we have the right gender? Do we have the right ethnicity? Do we have the same right comorbid conditions? Now, those are the things that that's the first thing that comes foremost in my mind is, do the AI algorithms that are created to look for patterns or predictions of disease, like you're saying, instead of being proactive versus reactive, are we using the data that represents the patients that we are seeing or what we are for ourselves? AI has the capacity to assess a large volume of data, large volume of real-time information. So I do believe that we have the potential to really see the benefit and enter medicine in a completely different new phase. The other issue is that we're all trained clinicians. And when we become reliant on AI and something showing us what are the edges and borders, show me the lung or the heart in the imaging, are we going to forget the basics and the intuitive medicine that we acquire with our experience? That's all. And I think that there's going to be also a change also in the demographics of how physicians are trained. And where there is going to be the need for providing clinical care. So those are just some of the things that I was thinking of when you were giving your incredible presentation about now that we're in the world of applications of ChatGPT and AI coming to the forefront, is how are we going to see it apply to our clinical arena? But thank you again. Those are just some of the comments I had.
Yeah, thank you, Monica. I think AI is getting better and better. If you just scan the literature on any topic, there are more than 200 to 300 papers, and there are more than 100 networks working on that. So there is, in fact, explosion of knowledge. And first time for healthcare, non-medicos are working hard. So I think this is what is called as a scientific collaboration between intellectuals, and health has become priority. That, in fact, I hope all of you know that all biggest developments in medicine were done by non-doctors. MRI was not discovered by doctor. CT scan was not discovered by doctor. Even ultrasound was not discovered by doctor. So I think these are all technologies which are done by non-doctors. And first time with AI, all these non-doctors coming into picture, and they are trying to make our healthcare better. So I think that is one of the biggest success of.
Dr. Suresh Kumar, do you have a question?
Yeah, really, I joined a bit late in this presentation. So one of my training has just forwarded today morning. So I just started joining this presentations a bit late, but thanks for the wonderful presentations. In fact, I am Dr. Suresh. I'm a consultant in infectious diseases at Apollo Hospitals, Chennai. I'm heading the information technology in infectious diseases, the national group called Clinical Infectious Disease Society of India. That is a society for infectious diseases similar to IDSA in US. So I'm heading the information technology in ID. In fact, we conducted our last meeting in August 2022. So I'm looking forward for this similar presentations from the people like you, because we are actively searching for who are all the people actively doing AI, machine learning, and big data analytics, in particularly topic like infectious disease. After the advent of COVID, a lot of things has come up. We, the specialists, people always ask who is infectious disease. We are the specialists dealing with all infections, sepsis, COVID, HIV, TB, and everything. That a lot of data is available. So I would like to do, because hardly India has got 100 hot IDs are there, infectious disease training across India. But if you see the problem faced by the infectious disease is huge. COVID has taught clearly what is the impact of COVID, and antibiotic resistance is another major problem. So we need inputs from you people there. We need to train them also, because a lot of training is needed for other doctors, because antibiotic is a right and left use medicines for everybody, but without proper knowledge. Only selected people like infectious diseases know how to use this molecule to prevent the resistance. But right now we don't have good antibiotics. So I like to ask the group who were presented there, so how to training the infectious diseases using this like a AI module to remote colleges. For example, a lot of medical colleges during undergraduations and post-graduations, there is no proper training for antibiotics. So we need to train the people in infectious diseases remotely, because we got only 100 heart specialists available right now. We got society, but the society conducts annual meeting and couple of knowledge meetings every month. But as a subsector or a sub-society of the ID, we want to take more training program with the help of AI, so that it's easy to train them. You tell a lot of things about the robotics and everything. We can do training and simulation there. Because, for example, the surgeon operates, he got infected, the patient is getting infections, we need to follow what happened during the surgery. It's very difficult. So we need to do the analytics part also. So mainly it has two goings. How to train the people, simply because I am a clinician, I'm a doctor, because we see patients and everything, but I need to know how to train the medical college students as well as clinicians regarding simple thing about antibiotics and infection control. And second thing, we are open to collaborations and research activity. Whatever things is happening in the lab, we need to check in the patient side whether it's really working or not. So we are open to it. So please feel free to contact us. I'll share my email ID as this number. Anybody wanted to do research and collaborations, our society as well as an individual, we are very happy to support the people there. So I look forward, and sincerely thanks for wonderful presentations. So this knowledge should be spread widely there. Yeah.
Thank you, Dr. Kumar. Dr. Suresh Kumar, I think I just restricted myself to imaging. Now, one of the wonderful things that can be done is in antibiotic policies. Now, clinicians don't use antibiotic, say what is called resistance or sensitivity, because it is not dynamic. So I created one model by which all microbiology centers can upload the sensitivity of their respective hospitals directly to the cloud, where it is dynamically maintained, and then it's available for the clinicians real time. So that suppose today I have a patient, I should know to which antibiotic, which bacterial sensitive in my hospital. So if it is dynamically available, the clinicians will use. I think this is something where only AI can do. Apollo is doing major work in telemedicine. I think he's a pioneer in telemedicine. In fact, I approached Apollo for developing a smart ambulance, where the ambulance becomes an extension counter of emergency ward. And we wanted to collaborate as a persistent system for developing a smart ambulance, where every data is available. And then we have gadgets, we have wearables, and everything could be gone to cloud. With 5G, everything is very fast. And therefore, even streptokinase can be given in the ambulance. So I think I just wanted more collaboration with Apollo. So maybe Dr. Suresh Kumar Kelly. Thank you.
Sure. Can we have Dr. Maria for a quick question?
Hello.
Yes.
I'm Dr. Kalimag, President of the Philippine Medical Association. I actually teach health informatics at the USC Faculty Graduate School at the University of Santo Tomas. and pharmacology at the UST Faculty of Medicine and Surgery. So actually, the main thing in artificial intelligence is actually big data. So it's all dependent on what we upload. So for example, we want to do antibiotic stewardship, and we want to know the resistance patterns. We need to have the antibiograms all uploaded in one system. Somebody has to develop the algorithms in order to look at the trends, no? The shifting patterns of antimicrobial resistance. And in the Philippines, we actually have Bantay COVID, no? That is artificial intelligence applied to COVID detection, COVID contact tracing, no? And it's ongoing up to now. So we're now in the process of actually evaluating the outcomes of the Bantay COVID. ANTAI, no, is Bantay is to watch over in Filipino, but instead of AY, we used AI because we use artificial intelligence for that. So we hope to be able to know the results of our study regarding that. So thank you very much for allowing me to share. By the way, I'm the new president of the PMA. Thank you.
Thank you, Maria. I welcome you over here and congratulations and Happy New Year. I would like you to join on all our meetings which happen every Saturday on this in time.
Okay.
So, do we have any other questions on the floor?
Dr. Surab, one question from my student. Can I ask?
Please go ahead. Let's quickly wind up the session after that. Yeah.
She has asked that what are the risks associated with the usage of artificial intelligence in healthcare?
I think this question was being asked and Monica did cover that question, but Dr. Jamkar, would you like to also highlight this question?
Actually, one of the thing of all AI, because it is all cloud-based with the data and everything. One thing is privacy. Second thing is security. And third thing, there might be inadvertent use. There might be some mishap going on. But I think that is because of personal things. And sometimes all these technologies, they try to what you call as overstate, and they become more ambitious. And you have to need to understand that it's a machine, and therefore you require a doctor to find out what exactly cannot be done. I think we should try to find out what AI system cannot do. I think if you identify that and taken everything with a pinch of salt, and we are never saying that AI system will replace doctors. AI system will help doctors, and at the end, human intelligence is required to find out how effectively we can use. It can help to reduce the time. It can help to reduce maybe efficacy. And then because of our system, we use with the human brain, and you have limitation of all our inputs. Whereas the AI system can help you with all these inputs to have a better suggestion for diagnosis and treatment.
So thank you so much. I see your comments from Dr. Monica. It says AI system can only make recommendation based on the data and algorithm they have been trained on. If the data and algorithm are flawed, the AI system could provide incorrect and harmful recommendation. And also, obviously, the sensitivity of the medical data and being used by the unauthorized parties. So do we have any other question quickly on the floor? I do understand this topic is very, very important, and in the interest of a lot of medical associations, I would like to bring some more, speakers and some more sessions on this particular topic. I also know there are a lot of things happening on MRI and CT scan, and what I understood from the company who is working on it, this is one added layer where so much of data is present in this artificial intelligence that it can actually save life. It cannot replace a doctor. It just gives a help to a doctor to analyze and predict the disease much faster than what it is in a manual error, and it avoids a manual error. So any final comments, Dr. Chong and Dr. Monica, or anyone, whoever is here? I don't see any medical association raising a question right now.
Thank you, everyone. Thank you, Dr. Jamkar, for that wonderful presentation. And honestly, yes, I think the fear is that the design of these decision trees in that they make in this, as a backbone of this AI, is actually can be fraught with a flawed design and so on. And really, I mean, a lot of input is required from the medical community with the designers of these decision trees, these layers that you talk about and so on. I've actually had some experience in this area of data science, and it's actually quite fascinating. And I've actually had a situation where the decision tree was flawed and the outcome was not what we wanted. So I totally understand. But I think over time, as the designers get more and more experience and the medical community interacting with them becomes more and more experienced with this process, becomes more familiar, I think all these issues will slowly sort itself out. But thank you very much for that wonderful presentation. And more importantly, it stirred our interest and it stirred our mind and opened our minds to the fact that this is here to stay. And, we should embrace it and we shouldn't be too frightened of it. So thank you, everyone, for this wonderful presentation. And I think we should have more discussions on this topic in the future. I thank everyone.
If you have a speaker who is good in this also, we can cover various more aspects about it. And let's cover this 2023 as an artificial intelligence from healthcare sector.
Yeah, I think that
should be a series of the presentation. There should be a series of presentations.
We'll cover it.
Thank you.
So thank you so much for joining in for this
Thank you.
session. See you again for the next session. Happy New Year, everyone.